covering all of San Diego. This is your Fox 5 News.
Still to come on Fox 5 Morning News, give your skin a refreshed look. We're going to show you a safe and quick way to remove those pesky brown spots. We're out on the back lot. We're talking about this. As people age, they often are bothered by uneven pigment in their skin, actually more than wrinkles, right, Doc?
Absolutely.
The number of spots can increase because of previous sun exposure. And Dr. William Groff, Bill, you said I can call you, right?
That's right, absolutely.
Dr. Bill, from the La Jolla Cosmetic Center, joins me now to show a quick, effective way to treat the brown spots and give your skin a refreshed look. Before we start, hi Karen, she's our patient. Before we start, what exactly are the age spots, the freckles, the whatever? What is that?
Well, as you see, we live in beautiful, sunny San Diego where the sun is always shining, and brown spots come about because of the constant exposure to ultraviolet radiation or the sun. So over time, as we age through the 20s, 30s, and into your 40s, you notice an increased number of these brown spots, which are basically a symbol of sun damage.
Really?
Absolutely.
That's it, period. Sun
Period,
damage.
yes.
There's no other reason for these things to show up.
Well, some women do have a condition known as melasma, which is hormone related, where they can get pigmented and brown spots, but most of the brown spots we see are directly related to sun exposure.
Okay, and let's talk about how we can get rid of them. Can you get rid of them with creams? Or
creams are generally ineffective. You may get a slight lightening of the brown spots, but in general, they do very little to help with brown discoloration.
okay, so if I come to you, what do you do to a patient to get rid of the brown spots?
Well, of course, first we take a look at the brown spots, and these are what are called lentigines. That's a big medical term. It just means age spot, sun spot. Some people call them liver spots, but they do age the appearance of the skin. If you think back to when you were maybe in your teens or 20s, you had this beautiful, clean complexion, no brown spots, everything looked nice and even. But as we age and as the sun takes its toll, you get more of this discoloration. So we use a laser. Actually, one treatment is all it will take to get rid of 80 to 90% of these spots.
Are you serious? So like this one here, Adam, which is, I guess, a little bit kind of large.
Yeah, here's a large, darker spot.
One treatment on that one can get rid of it?
One treatment, and most likely 90 to 100% go on one treatment.
Okay, can we see what you do, what the
Yeah,
procedure is
absolutely.
like?
We're going to get the laser ready.
Okay, and
We
Karen.
all should put on our safety goggles, so Courtney's going to hand those out.
Okay,
Safety first, of course.
thank you.
And Courtney, can you hold this for me? I'm just going to put on some gloves here.
Okay.
Now, the advantage of the laser over some things you may have heard of, like a photofacial, for
Yeah,
example.
I've heard about photofacials.
The laser will knock these spots out in one treatment, whereas the photofacial may take 4 or 5 treatments and repeat visits to your dermatologist.
Okay.
So here we go. Everyone have their goggles on? Okay. So you
it's
can
a little bit of a...
see the little bit of frosting to the skin there? That's a perfect reaction. That's what we want to see.
So it kind of burns a little bit. Seems like it.
It's not actually burning. It's just, and you can see, are you having any discomfort with that?
No, I'm not.
It's a very easy treatment, and we can use this treatment anywhere in the body, whether it's the back of the hands, the center of the chest, anywhere in the body, legs, stomach.
Now, I do have a couple of questions regarding this, and I want to know, first of all, can't you deaden the skin if you're really sensitive?
Well, actually, we did. Yeah, you can put an onion cream on the skin for a half an hour, and she'll feel absolutely nothing. So
now, what exactly, in the most simple terms that you can describe, what is happening when you zap her?
Well, this laser has a specific wavelength of light, and it targets the melanin or the pigment cells in each spot, and it breaks them apart. And then over a period of about 5 days or so, this will just slowly peel off the skin, and it's completely gone. It's really amazing.
Now, you said 5 days. Now, if Karen has to go to work, say in 2 days, can she put makeup on?
Oh, absolutely. You can cover this right away with makeup. And this whiteness will go away in about 2 hours, and then the spot will just look slightly darker, but you can cover it up completely with makeup.
Now, of course, as you know, you're a doctor, a dermatologist. Do you know that darker skin can tend to get marks from something like this? So what happens with that?
You mean from the treatment itself?
Yeah, from the treatment itself.
That's absolutely true. So
I mean, someone with skin tone like me.
Right, so you have to treat a little more gently. You can't be quite as aggressive. It may take 2 treatments, and a lot of times afterwards we'll stress some topical therapies as well. They'll help assist in the patient not developing any discoloration from the treatment itself.
And then, like, once you use these brown spots, how quickly will they come back?
As long as she's good about using her sunblock, these should never come back. Now, if she went out and laid out and didn't use her sunblock, there is a chance that they could come back.
Okay.
But usually they're going for good.
And just price range, how much does this cost?
Oh, anywhere from a couple $100s for a couple spots to, if we were doing large areas or multiple areas, it could be $1,500.
And you can get as many as done as in one sitting as possible?
Yeah, my partner, Dr. Fitzpatrick, and I do, we use this laser every day, and we do treatments 5 days a week, so.
Okay. All right, well, if you want to see Dr. Bill Groff, Dr. William Groff, he's at the La Jolla Cosmetic Center, so thank you very much.
Thank you very much. I appreciate it. Thank you.
Definitely. All righty, guys, back to you.
Okay.